It's interesting, they already have 6 FDA indications. Each of the 6 FDA indications for GLP-1s currently are all overrepresented in people living with mental illness. But we're talking about substance use and alcohol use, and I was thinking this morning as I was walking over an interesting history, and that is that for me it's an interesting story because in addition to being fit for purpose, in the 6 FDA-approved indications, many of us in the room are already using off-label GLPs to counteract clozapine-induced weight gain, polycystic ovarian syndrome, which is more common in women with bipolar disorder than the general population. By the way, that increases fertility in women who take these drugs for PCOS. And we also, in fact, now are considering these as applications, not just to food addiction, but also alcohol and substance use. And the rationale is provided by the mechanisms, plural, and we've discovered that Ozempic is produced in the back of your head, in the nucleus tractus, and it projects up to the striatum, up to the VTA. And when in fact this nucleus tractus set of neurons is activated, they project to the striatum, and they modulate these little GABAergic neurons, these inhibitory neurons, in the VTA. The good news is that when you're presented with a cigarette or alcohol or opioids or cannabis, the burst of dopamine is reduced. Therefore, there's less abnormal cue-based reinforcement learning. But in addition to that, the GLP-1 also projects up to the hippocampus, which we depend on for memory. So in other words, what's happening is the GLP-1 is recalibrating the reward reactivity and the cognitive control of the reward reaction. Hence, we see this correction in an abnormal food consumption behavior, but food is a rewarding experience. The substrates that are subserving food consumption are overlapping with drugs and alcohol. So we see, in fact, now evidence, which is a concatenation of evidence, showing that the administration of the GLP type drugs reduces abnormal cue-based learning and abnormal consummatory behavior. That's now been highlighted not just in the animal models, but also in human experiments. People living with substance and alcohol misuse are reporting a decrease in the craving, decrease in the consumption, and decrease in relapse. A lot of these folks, especially with tobacco use, they have weight gain subsequent to discontinuation, and the post-cessation of cigarette-induced weight gain is subsequently reduced. So this is certainly something very exciting, and randomized controlled trials now have documented a decrease in the heavy drinking and the number of heavy drinking days. So where are we today? Well, they're not FDA approved for these indications or these purposes, but they are under study across tobacco, opioid, and alcohol especially, and results look very promising. But a little word of caution, safety first, and we know that in this population, among other reasons, they are at risk of pancreatitis, which could be a safety concern with this class of medicines. We also know that people who take opioids, for example, are susceptible to gastric and GI motility problems, and that could be an issue with some patients taking these medications. And thirdly is sarcopenia, the loss of muscle mass. So because of nutritional deficiency, inactivity, other reasons including direct toxicity, for example, alcohol and its metabolite are muscle toxins. And these reasons and others, patients with alcohol and substance use disorders have higher risk of muscle loss. And you probably all know that about 1/3 to 40% of the weight loss with GLPs is lean mass. And that loss of muscle tissue can be very significant for some people. That's ignited a research pursuit to identify drugs that can attenuate that effect called myostatin and activin inhibitors. And stay tuned, they're coming very, very soon. But in the interim, a call to action, that being to nutritional optimization, exercise, resistance training, and be aware of some of these other aspects that could interact. But nonetheless, this remains an extremely opportunistic area. Stay tuned. The next 1 to 2 years, we're going to see readouts of studies.